Hello everyone, I am Neha Badalia from MedSearch India. Today we have an esteemed guest, Dr. Mukesh Patekar. He is a unit head of medical oncology at Artemis Hospital, Gurgaon.
Hello guys, my name is Dr. Mukesh Patekar. I am Senior Consultant, Head Medical Oncology at Artemis Hospital, Gurgaon. Today we are here to discuss most commonly asked question in the oncology.
Can you explain what medical oncology is and what an oncologist's role in cancer treatment?
Okay, basically medical oncology is a branch of internal medicine where it is specifically deals with the patient having cancer. So that is called as medical oncology. And role of medical oncologist is to diagnose the cancer patient, treat the cancer patient, define the line of treatment, whether surgery, chemotherapy, or radiation will go in sequence, depending upon the analysis of the patient, and further plan the patient treatment of the patient.
What are the most common types of cancer you treat and how do treatment differ based on the type?
Basically, the male and female they have different demography. If you talk about the in males, the cancers of the lung, oral cavity, esophagus, and uh, cancer of the stomach. They are top four most commonly diagnosed cancer. If you talk about the female patient, we have breast cancer, cervical cancer, uterine cancer, ovarian cancer, and stomach cancer. These are five different most commonly diagnosed cancers.
How do you work with other specialists, such as surgeons and radiation oncologists, to develop a comprehensive treatment plan for patients?
Basically, each dedicated comprehensive cancer center has multidisciplinary tumor board where the surgeon, radiation doctor, and medical oncologist sits together and plan the treatment. Like in breast cancer, we need surgery, we need chemotherapy and radiation therapy. Like in other certain tumor types where we need interaction between three specialties. And generally, we do always call them, go to their OPDs and discuss the exact plan of action. That is how we work as a team.
What are some of the most exciting advancements in cancer treatment in recent years?
Yeah, you must have heard about the immune therapy. Last 5 years, the immunotherapy has changed the treatment paradigm. Like in lung cancer, kidney cancer, melanomas, some Hodgkin lymphomas. It has there in the first line stage 4 cases and it has given the cure to the most of the patients. Apart from that, we are always discovered the precision therapy or targeted therapy. So we are doing some genetic analysis and identify the target. Like in lung cancer, stage 4 lung cancer, we identify some genes and we prescribe treatment according to them. We call that targeted therapy. And nowadays, you must have heard about the CAR T cell therapy, which has changed the treatment in the leukemias, lymphomas, and nowadays CAR T cell therapy might come into the solid cancer also.
What are some of the biggest challenges in oncology today and how are they being addressed?
If you talk about me, the biggest challenge in the oncology, one thing I found is the misconception. Okay, a lot of people do run away from their treatment. They just get brainwashed by some alternative therapies or complementary therapies or some Ayurveda, which is not scientifically proven most of the time. Sometimes, obviously, the oncology treatment is expensive. So most of the important factor when you want to give any target therapy or a high like robotic surgery, so the cost is also apprehension in terms of the patient's mind that that is the inhibition on the patient party also. And if you talk about the village level or some second tier cities, where the patients think that if they get cancer, then it is a death sentence. So percent of the patient that cancer is treatable if it is diagnosed in early stage, cancer is curable if it is diagnosed in early stage with proper model.
How do you approach treatment decisions for patients with late stage cancer?
Generally, most commonly people are get diagnosed with the late stage. That means stage 3 and 4. Most commonly we have stage 4 cancer. So if treatment of stage 4 cancer is not curative, we always believe that we have to prolong the life of the patient. We have to give good quality to the patient. And some fortunate cases, even despite stage 4, they can live long, maybe 3 year, 5 year, and some might get cure also. Really.
What are some common misconceptions about cancer treatment, especially regarding chemotherapy and radiations?
Okay, so a lot of people have a misconception about chemotherapy. Some patients feel that chemotherapy will harm them. Chemotherapy will likely to increase the cancer rapidly. Some patients have a myth that the chemotherapy drugs are derived from the from snakes venom. some patient have this kind of thoughts also. And some patient have the chemotherapy means they will not going to get cure, or they will not going to better. Regarding the radiotherapy, some patients feel that radiotherapy they are getting some kind of burning, or they don't understand what is the meaning of radiotherapy. So, with proper explanation, proper suggestion, or proper awareness might help them to negate this kind of apprehension.
What advice would you give to someone who has just been diagnosed with cancer?
See, first of all, any newly diagnosed cancer, we have to reassure them. Whatever may be the stage of the cancer, it is still treatable nowadays. So if it is early stage, like stage 1 and stage 2, or maximum stage 3, we can say that they will still have a chance of cure. In unfortunate stage 4 cancer, with era of immunotherapy, target therapy, and highly in technology, we can say that 5 to 10 5 to 10% patient can still be long-term survivor. So this is how we have to give them a confidence and reassurance. That is the thing.
What role do lifestyle changes like diet and exercise play in cancer prevention and recovery?
Correct. So if you look at the causes of the cancer, smoking, alcohol, obesity, sedentary lifestyle, dietary habits like smoke food or lot of packaged or junk food, these are the notorious factors for certain kind of cancer. If you take care of your obesity, if you quit tobacco, if you quit alcohol, or if you have a healthy lifestyle like physical activity and healthy eating habits, they will certainly reduce the risk of cancer by around 30 to 40% cases.
What are some emerging treatments or clinical trials that you are most excited about?
Correct. See, the cancer treatment is always a dynamic therapy. Every day we are getting newer drugs in the market. It is the scientists are doing research on the next line. Like we have immunotherapy now, people are trying to see different kind of combination for immunotherapy. They are trying to identify the different defects in the genomic level to identify the cause of the cancer, how they can hit with certain oral pills. So there are many trials are going to happen and happening also, so that many patients will get maximum benefit out of those, because cancer will not stop. So treatment of cancer will definitely evolve, and one day the cancer will definitely depend upon the targeted therapy or precision therapy.
What are the future of oncology looking like in the next 5 to 10 years, and how can patients prepare for it?
I think oncology is going to be evolved over the period of time. Every day we are getting the new molecules. Like immunotherapy has changed the treatment of many cancers. CAR T cell therapy is revolutionary in the field of leukemias, lymphomas, and our dear scientists and the researchers doing the good job getting the newer immunotherapy based combination. The newer targets are being identified based on the next generation sequencing. So next 5 to 10 years are always a kind of exciting as far as medical oncology concerned. We are having robotic surgery, less invasive surgery. We have cybernetic machines, newer technology, and yes, we have proton therapies. We have MR linear therapy for giving radiation. So there are many exciting things are happening now. Nowadays they are expensive, but I think over the period of time it will get cheaper, and most of the time patient will get benefit of this high-end technology.
Thank you everyone for watching this video. Don't forget to like and subscribe this channel for future updates.